Good afternoon, folks. This afternoon's topic is navigating end of life care for families. So we're going to get into that for discussion A this afternoon. Now, with all of my shows I do, let's get this out of the way. Like at the end of the show, if you guys want to comment, leave me show ideas, things of that nature, leave it in the chat below for me, and I will see what I can do about getting you an answer to your question, or a answer as to if I can do a show about your topic or not that you bring up. So with that being said, let me get set up for the show here, and we will get going shortly. One second, folks. To put my gear on. Back up so everybody can see me. Make sure that makes sense. Okay. Headline: Deep dive navigating end of life conversations with patients and families. End of life conversations are among the most emotionally charged and ethically complex intersections in healthcare. This guide reframes them as not as singular, daunting events, but as ongoing relational processes that honor the patient's humanity, clarity, or clarify medical realities, and support families through anticipatory grief and decision making, drawing from clinical best practices, palliative care principles, and communication science. This page offers a roadmap for initiating, sustaining, and documenting these vital discussions. Purpose and philosophy. At its core, the guide emphasizes that end of life conversations are not just about medical decisions, they're about meaning, values, and relationships. These dialogues help align care with what matters most to the patient, rather than defaulting to aggressive interventions or crisis driven choices. reduce reduce moral distress among clinicians and families by clarifying goals and expectations early, support bereavement and legacy building, allowing families to feel they honored their loved ones' wishes. It encourages a shift from what do you want us to do to what are you hoping for, and what are you most worried about. Questions that open space for emotional truth and shared understanding. Who is this who is this for? Clinicians and trainees, physicians, nurses, social workers, chaplains, and others who need structured communication tools, role play practice, and ethical framing. Patients and caregivers, individuals facing serious illness or supporting loved ones who want to express preferences, ask questions, and feel empowered. Health health systems and educators, organizations developing protocols, training models, or public campaigns around advanced care directives. And advanced care planning, hospice, and organ donation. Key objectives: build trust and rapport. Start with the patient's story, values, and understanding of their condition. Clarify prognosis and options. Use honest, compassionate language to explain what is likely and what is uncertain. Document preferences. Encourage use of advanced directives, pull list forms, and naming a health care proxy. Normalize the conversation. Treat these discussions as routine, not explanational, and integrate them into care pathways. Practical tools and techniques before the conversation. Review the patient's medical history, cultural background, and likely disease trajectory. Prepare emotionally. Acknowledge your own discomfort by basis or bias. Use open-ended questions like, what does a good day look like for you? Or have you thought about what you'd want if if things get worse. Of it, avoid euphemisms saying dying or death when appropriate, with gentleness. Focus on trade-offs: time versus function, comfort versus longevity, independence versus intervention. After the conversation, summarize and document the discussion. Share notes with the care team and family. Revise the conversation as conditions change. Common challenges and solutions. Barrier, clinician discomfort, or lack of training. Use simulation coaching and AI assisted role play tools. Build confidence. Normalize repeated conversations. Involve chaplains or social workers and clarify medical realities gently. Advocate for triggers, e.g., hospital admission, diagnosis of life limiting illness, to prompt early conversations. What patients and families can do. Start early. Don't wait for a crisis. Name a healthcare proxy and discuss values while healthy. Ask for clarity. Request plain language explanations of prognoses and likely outcomes. Use available resources. Seek palliative care consultation or consults, hospice information, and culturally relevant guides. Share your wishes. Write them down. Talk about them with loved ones and revisit them as needed. The guide also acknowledges that end of life conversations must be culturally responsive. It encourages clinicians to ask about spiritual beliefs, family decision making norms, and historical mistrust. Use interpreters and culturally adapted materials. Recognize that a good death may look different across communities. This resource is not just a communication guide, it's a call to humanize care, reduce suffering, and empower patients and families to shape their final chapter with dignity and clarity. Okay, folks, so that is A for you. Now, I'm going to do the end of the show a little different. So, if you guys have any questions about the show I just did, leave them in the comments below for me, and I will get you. I will try to answer your questions for you, or get you answers by via doing another show attached to this one. So let me know, folks. I'm going to hang out for a few minutes with the show and see what happens with answers for y'all. Okay, so I will stay on here for a couple minutes. Let's see if anybody has any comments about the show. Hopefully this helps somebody understand things. Because as I said when I started the show, long time ago, I'm here to simplify medical elderly terms for people. I'm here to put in plain English people's questions and answers about elderly care, things that I'm certified in. So, like I said, if anybody has any questions or comments about the show, leave them below for me, please. Different.